situation looks like when you have a loved one critically ill in intensive care. Stay tuned, I've got news for you. My name is Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. With my videos over the many years here at intensivecarehotline.com, I've been talking about, what is a real versus a perceived end-of-life situation in intensive care. And, perceived end-of-life situation is that there's a perception that there could be an end-of-life situation, but there's often things that can be done, right? And often a perceived end-of-life situation can be turned around. However, there are also real end-of-life situations where no treatment, no medication, no surgery, no equipment, no resources can really save someone's life. And today I want to actually focus on that. We've been working with a client recently who has had their loved one pass away in intensive care, unfortunately. And that was after multiple cardiac arrests, within a reasonably short period of time. Within a few days, initially the patient came in with a cardiac arrest and then had ongoing cardiac arrests after about 2 weeks in intensive care, and things weren't looking good. Patient went into kidney failure and ended up on dialysis for kidney failure, right? Ended up on multiple inotropes and vasopressors such as norepinephrine, levophed, vasopressin, phenylephrine, and so forth at maximum doses, right? And maximum doses means that, you have to give, when blood pressure is low from a cardiac arrest, for example, and not compatible with life, that's when you need to give inotropes or vasopressors that increase the blood pressure with infusions, right? But then there's only so much you can go up with a weak heart. The heart was very weak. That means, no matter how many inotropes you are giving, it can no longer compensate for a weak heart, right? Then another sign was that the ICU had to take the patient off dialysis because, again, the blood pressure was going down too low by being on dialysis, right? Basically, organs were shutting down, right? And pH in the blood was very acidotic, right? So lactate increased, right? You got to look for lactate levels in a situation like that. And when lactate keeps going up, it basically means that the body persistently produces too much lactic acid. And that is a sign that liver and kidneys are consistently not functioning well and are basically shutting down. This occurs in the context of a critical illness. And as blood lactate levels continue to rise and pH levels fall, cardiac output is increasingly suppressed, which leads to organ failure and death. And, those are clear signs that unfortunately a patient in intensive care is dying. Other signs in a situation like that are clearly that ventilation requirements are very high, i.e., this particular patient was on 100% of FiO2. That means 100% of oxygen from the ventilator in a controlled ventilation mode, meaning the ventilator was doing all the work, right? The patient could no longer do any attempts to breathe at all, right? With a PEEP of 12 and with a rate of 35, right? And bear in mind, when I say FiO2 100%, right? Room air, the air that you and I are breathing, is 21%, right? So that means the ventilation requirements were maxed out, right? So this is what a real end-of-life situation looks like. Lactic acid, by the way, was 7. Normal level is below 1.5. White cell count was high, which suggested an ongoing infection. Low sodium levels, creatinine was high, BUN was high, GFR was high. Those are signs that unfortunately a patient is dying and that nothing can save someone's life. Now, please keep in mind that approximately 90% of patients in intensive care survive, right? That's the research. So please keep that in mind as well. If you're watching this and you're wondering, is your critically ill loved one dying, and what are the odds? The odds are usually 1 out of 10 isn't surviving in intensive care. So the odds are actually in your loved one's favor. Now, in this particular case, there were other, issues adding on to it. The patient had chronic AF, which is atrial fibrillation, was on amiodarone, and had heart attacks even prior to going into ICU. So the prognosis wasn't great right from the start, but I just thought you needed to understand what a real end-of-life situation looks like. And in a situation like that, unfortunately, there's nothing that can be done. I've worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013 here at intensivcarehotline.com. And I can confidently say we have saved many lives with our consulting and advocacy. And you can verify that on our testimonial section at intensivcarehotline.com. And you can verify it on our intensivcarehotline.com podcast section at intensivcarehotline.com, where we've done client interviews that verify the work we've done for them. And we have helped hundreds of clients and members over the years. And that's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivcarehotline.com. If you click on the link, on the membership link at intensivcarehotline.com, or if you go to intensivcaresupport.org directly in the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And all of that will help you to make informed decisions, have peace of mind, control, power, influence, making sure your loved one gets best care and treatment always. I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you can't afford to get wrong. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. If you have unanswered questions, if you need closure, or if you are suspecting medical negligence, and all of that you get at intensivcarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivcarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my email newsletter at intensivcarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivcarehotline.com, and I will talk to you in a few days. Take care for now.